Hey, good morning, everyone. We're just going to give everyone another minute or two to hop on. So we'll start then. Okay, I think that's a good amount of people, so we can get started. Good morning, everyone. Again, welcome and thank you for joining us for today's virtual training, Planning to Improve Crisis Response Prevention Through Stepping Up. I'm Gretchen Frank. I'm a Senior Policy Analyst at the Council of State Governments Justice Center. For anyone new that's joining, I manage the Pennsylvania Stepping Up TA Center, and I'll be moderating today's virtual training. This training is presented by the Pennsylvania Stepping Up Technical Assistance Center, which is funded by PCCD, the Pennsylvania Commission on Crime and Delinquency. PCCD has a committee called MAGIC, the Mental Health Justice and Advisory Committee, which is jointly run by OMSAS, and the TA Center really functions out of input and support from that committee. So just want to thank PCCD as well as OMSAS and MAGIC as we begin today's session. A note before we get started that we are recording the session so that those who couldn't join us can still view it later on. We'll share the recording of the training along with PowerPoint slides with participants when those are available. If you have any questions coming up for you as we go along, please feel free to write them in the chat at any point. We are focusing today on the front end of the system, knowing that many counties have been focusing their efforts here, working to further enhance their crisis systems to decrease the likelihood that individuals with behavioral health needs, including those experiencing homelessness, will face criminal justice involvement to begin with. Counties are really concentrating here, knowing that law enforcement officers are often the first to respond to people experiencing a mental health or other crisis, and they can't address the disproportionate number of people with SMI in local jails without diversionary alternatives being available to them. The past year and a half through the COVID-19 pandemic, as you all know, really highlighted in particular the importance of diversion from the justice system as early as possible, and that elements of the system's change framework that Stepping Up emphasizes, such as forming partnerships and collaborating across sectors, are really important, applied to this particular population especially, but applied generally as well. And planning that includes a group of diverse stakeholders and that's informed by data is so important to these responses being implemented most effectively as part of a comprehensive and coordinated crisis system. Because housing is so integral to preventing future crises and reducing involvement in the criminal justice system for people with mental illness, counties will be more successful in their efforts when housing partners are included in the crisis planning and coordination efforts and best practices are utilized. And to this topic, we'll be hearing today from one of my colleagues on our housing team here at the Justice Center, who will speak about best practices for leveraging housing as a platform for crisis diversion and stabilization. Following that, we'll hear from representatives from both in and outside of Pennsylvania on their crisis work. Allegheny will discuss strategies that they've employed to build upon and enhance their existing crisis system even further, and including very thoughtful and collaborative planning process that they've undergone. And Dallas County, Iowa, which is one of our Stepping Up Innovator counties, will then discuss some of their own crisis services, how they've utilized data to enhance their system, and how they've worked and continue to work toward a more complete and coordinated crisis system. We know that local communities that have built comprehensive crisis systems have seen positive outcomes, including improved access to treatment, fewer days spent in jail, and cost avoidance and savings for both healthcare payers and criminal justice agencies. And though a crucial step to improve outcomes for this population, we know that this is a really challenging area. So we hope that today's virtual training provides you with some strategies or next steps that can be taken back and used to further advance toward your stepping up goals. In addition to our presenters today, many Pennsylvania counties, including probably many counties on the call right now, are doing really great work in this area. And we've heard interest from some of you in having opportunities to discuss with other counties. So we look forward to discussion following the presentations, which we think will be a helpful way to explore some barriers and strategies further. So here is the full agenda today. As I mentioned, we'll be hearing first from a colleague at the Justice Center, Thomas Coyne, Senior Policy Analyst, to speak about practices for leveraging housing to divert from and stabilize after crisis. Then we'll hear from Allegheny County, Pennsylvania, followed by Dallas County, Iowa. Then we'll have time for question and answers for all the presenters, but feel free to reach out with any questions at any point, write them in the chat. Then we'll split up into groups to discuss the topic a bit more in depth with one another, and then return back to share any final thoughts and to close. And here are our speakers for today, and I'll announce them as we go along. Just very quickly, for anyone new to our events, the Council of State Governments Justice Center is a national nonprofit working across all 3 branches of government, work on many different projects, including Stepping Up. And for the Stepping Up initiative, we partner with the National Association of Counties and the American Psychiatric Association Foundation to do that work. And for anyone unfamiliar with Stepping Up, Stepping Up is a national initiative that seeks to address the over-incarceration of people with serious mental illnesses and co-occurring substance use disorders in jails. The Pennsylvania Stepping Up TA Center, funded by PCCD, really allows us to provide more targeted technical assistance to the Pennsylvania counties and work using Stepping Up's cross-system planning and implementation framework for systems level change. And while the Stepping Up measures that we recommend counties focus on are mainly collective with jail, most of the strategies and solutions to really reduce prevalence are found outside of the jail, but in partnership with it. So by focusing in on the jail and measuring progress there, we can really see how well systems are working together overall in the community to ultimately reduce incarceration for people with mental illness. And this is just a reminder of the 4 key measures, and just to show that we're focusing today on key measure number 1, reducing the number of bookings for serious mental illness to begin with. So there's just some examples of some potential system improvements under there, and some of our presenters may touch on a few of these system improvements that they may be utilizing themselves. So with that, I am going to turn it over to Thomas Coyne from the Justice Center to start us off in discussion around connecting people in crisis to housing and diversion from arrest. Thanks, Thomas.
Thanks, Gretchen. I'm really glad to be here with everyone today. Again, my name is Thomas, and Senior Policy Analyst here. And I come at this work both from the housing policy space as well as from the community behavioral health space. So being a case manager both here in Washington, D.C., where I'm based, as well as rural Michigan. We've been working on Pennsylvania work for just about 2 years now, so definitely some familiar faces I see in the participant list. So good to see some familiar names. So today we'll go over the usual progression of what we see in crises, also what we see with what we can intervene with crisis systems and housing, concrete examples of this really interesting crisis work that's going on in the US. And ending a bit with some steps on data as well. So on the next slide, we see that in communities that are actually collecting these data, and we see that the usual outcomes when folks in law enforcement are encountering people who are experiencing homelessness, and that's arrest. In cases such as this, we see that sometimes just the number of encounters are just exceptionally high, and then often those encounters are leading to arrest. I think we had probably a really poignant, really concrete example of this last week, unfortunately, in Perry County. If you've all seen where someone misread a sign in a convenience store, put down $2 rather than $2.49. And due to a swirl of circumstances, including homelessness, that 49 cents then resulted in a felony charge and another person in local jail, rather than diverted out into our many, many other crisis systems. So on the next slide, and as we're saying, like, results that a fair number of folks in jail who are experiencing homelessness. And so on the next slide, we know from there that really the collateral consequences really pile on. And that ranges from eviction and loss of jobs to housing just getting significantly harder, like trying to pass a record check with a private landlord. That's just that much harder, as well as formal barriers from the state, although Pennsylvania has fewer barriers than other states. And also a loss of connection with those providers that provide stability. I know that my agency, we had to discharge folks after 6 months of incarceration, and we were a long-term place that people would be with us from the time that they were diagnosed with mental illness until basically the rest of their lives. Even if I knew that someone was getting released on a specific day, even if I set up their psychiatry appointment, if they got released without notification before I got to jail, they missed their appointment. In some cases, they would then relapse also, because that's something we know happens, unfortunately, all too common post-jail. And all the in-reach that I'd done, all the work that they've done while they're incarcerated, that was all essentially wasted by a lack of formalized coordination. All that in-reach, all that coordination doesn't even have to happen necessarily if we're doing things up on the front end to get people out of these systems before it happens. So on the next slide. And so I think really we all really know that we'd like to get ahead of all of that. And that there's just so many different opportunities to get someone in crisis, really to get them the right supports. Again, thinking back to my behavioral health days, the progress for someone would typically be like, say, if someone was either experiencing homelessness and was at a community provider, or maybe at a group home, staff member would reach out to their supervisor and then to me, who could divert someone to a CSU, a crisis stabilization unit. Then if needed, like reach out to multiple crisis, and who could then also divert to a CSU or a hospital. And if the police needed to be involved, usually both myself and mobile crisis would stay engaged. I'd stay at the endpoint, whether it's hospital or at a shelter or somewhere. Even if mobile crisis then left to handle the next case, and even if law enforcement remained, having that long-term supports on top of everything. We see local communities are really now bringing the funding to stand up 988, and will be over the next couple of years, as well as the planning funds that are coming down to states through the American Rescue Plan for mobile crisis. Just really important that local communities are making sure that their state partners are really investing those funds back into planning. And we also have leaders in the field too, such as Wichita, that are training their 911 resources throughout calls, such as those involving homelessness, to trained responders, such as folks who are on homeless outreach teams. And of course, 911 can always revert folks back to crisis lines and ultimately get people connected to the things that are really stabilizing, such as CSUs, mobile crisis, and ultimately housing, permanent housing at that. Or shelters, as not all communities have permanent housing, permanent affordable housing available immediately, and sometimes we need to then have those connections to shelter and services to make sure that folks aren't falling through the cracks while we're trying to find permanent housing for them. And so on the next slide, why the end point of housing and permanent housing at that with services. We know that it contributes to the good outcomes we want to see, reduced involvement with our criminal justice systems. It's a place to find stability and a place to connect with providers. And from experience, it's a lot easier to knock on someone's door to find them than it is to develop a network of people who are also experiencing homelessness in the community who just happen to be familiar with their client. Really useful, but a lot harder to do. It's much harder. And so with housing, on the next slide, we have a range of options to keep people both stably in their housing and get them back quickly into housing. So this ranges from making sure that folks are connected to SSI and SSDI, making sure that they're receiving their economic payments through the American Rescue Plan, to prevention funds, such as, again, those available through the American Rescue Plan, including the Emergency Rental Assistance Program, to make sure that folks aren't falling behind, especially due to the pandemic, but generally aren't falling behind, or I work with folks all the time who fell like a month behind rent, and then their landlords would call me and try to resolve those things. And oftentimes there's local community action agencies that can help provide that. A stabilizing resource of prevention funds. And then to developing forms of rental assistance and building new housing, which, as we know, I think probably all know that one way to reduce homelessness and the crises associated is to develop new housing, to make sure that there's actually housing available. And then there's ways to get folks back into housing, through Housing First, rapidly through rapid rehousing, that quickly connects folks to intensive services that scale on down once a crisis ends. And of course, there are folks with the highest needs, folks that we often work with in the stepping up population, folks with really high complex care needs. And so pairing rental assistance then with services like sort of community treatment or intensive case management. And so on the next slide, some locales are really already doing these connections and really moving these things forward, such as connecting folks to permanent housing, using the waypoint as crisis services, and having law enforcement be able to divert folks from arrest to crisis services, and then really making sure that they're able to get connected to permanent housing following that folks have a place to land. And on the next slide, and some cities have really turned their entire systems around using probably what's best described as whole of government approaches, which really, with how many different systems both impact homelessness and have a role to play in homelessness, really how homelessness should be approached, and crisis needs as well. And in this case, Sarasota has been able to leverage law enforcement and non-law enforcement responses, also using shelter space and permanent housing, all to make sure that folks in crisis who are just experiencing homelessness generally are getting connected to the right services, and getting connected to also the evidence-based practices that really work and pay off long-term. And really seeing that this is having a big impact in the community with results that I think any city would be very, very happy to achieve. So on the next slide, we see too that it's not just intervening with things that cost a lot of money, which those things pay off, but not just bringing funding to bear always. Sometimes it's just intervening with education, with educating all of our partners who are at the table. And, I think we're still, maybe not just still, but always hearing that sometimes a law enforcement response to folks in crisis will be arresting them and putting them in jail, thinking that they're doing them a favor, that this is a safe place. And there's nowhere else to turn in the community. I heard that actually like just last week. And there are just so many chances to divert that we can do. And I think at the heart of it for all of us, is probably like I can ask even now, like, does anyone here in the webinar like not have silos in their community? Because certainly here in DC, certainly in rural Michigan, like, yeah, absolutely, there's just silos everywhere. And having those resources at our disposal to divert folks really depends on breaking down those silos. And even in Appalachian, Ohio, really means getting to know the folks in your community, so you can get folks into places that are both stabilizing and don't necessarily then result in all of those collateral consequences. And we can also leverage our data that we're collecting, even just jail rosters that are checked by a local behavioral health board. It doesn't have to be like really complex data matching projects that are automated every day. It can just sometimes be having a case manager go out and check a jail roster a couple times a week, as Athens is doing. And with that, really can make really consequential change for folks who are otherwise getting wrapped up in this cycle of involvement with the justice system. And new resources for crisis services, as we bring them to bear in our communities, it really does require community education. Here in DC, even with the homeless outreach line, even with the mobile crisis line, even with me calling homeless outreach, sometimes a neighbor will call 911 at the same time, maybe even after I've called, and law enforcement, just with how many more law enforcement officers we have, that probably most communities have compared to homeless outreach teams. They're there in a few minutes, whereas like homeless outreach would take like 10. And it's just a place where then those potential connections to stabilizing resources, that connection to a case manager gets lost. And we lose that opportunity to otherwise get folks stable and in services, and then maybe even disconnect them from some of the services they were receiving before. And so on the next slide, really just want to hammer home that just data is just so integral to this. And it ranges from like making the case for housing that we'd all probably love, especially that is so useful for decision makers because they both like and need to see numbers when justifying the amount of funding that can be spent for housing. As well as, especially for stepping up, like we have the 4 key metrics, and layered on top of that and across that, we really can't address or track our progress towards race equity without seeing the numbers, to keep yourselves and our partners on a path for success. Like that's just not possible to do. And there are still partners then to reach out to. They might be hesitant, like, understandably so, right? But we've seen great work across the country on care coordination and creating aggregate non-PII container reports to make the case. And also this is something that HUD permits. I think we've seen this across the state in Pennsylvania with great sharing of data. And really, we just know it's possible with Pennsylvania and possibly in Pennsylvania and across the country. So, and with that, I'll turn it back on over to Gretchen. And I think actually apologize, we've got our resources to go through. Yeah, so we've got some resources that I wanted to pass along today. These include both our recommendations and findings from the Stepping Up Pennsylvania behavioral health scan that we completed earlier this year in 3 key priorities that I think might be of interest to everyone here, including data sharing, increasing local diversion options, and connections to housing. Also wanted to leave you with a list of contexts with HUD continuums of care, and especially in data sharing, I really wanted to emphasize that can reach out to folks who are the HMIS lead and start those conversations. They might not be open to sharing right now, but the way to work towards sharing, of course, is those early conversations. On the next slide. Also, my colleagues have done a really excellent job generally and this year in putting together some really useful resources on crisis services. And this includes a matter of public health and public safety, and how states can really support this and bring this to your state colleagues and really show them the ways that they could be supporting local crisis systems. On the next slide, also some steps for building local crisis systems as well. And on the next slide, also wanted to leave you with some of the larger resources on the American Rescue Plan in 8 key areas that we've put together. And on the next slide, also just want to leave also some information on additional HUD sources of funding to develop new housing and some of the rental assistance programs that I touched on earlier. On the next slide, also just a really quick piece on the state and local rental assistance program. Just a list of ways to get folks connected to these preventive sources of funding. And on the next slide, again, as folks are looking to fund these resources, we have a database of federal funding sources to support this work, as well as, in addition to federal resources, generally also sustainability workbooks and tools to help you work through these questions of how do I sustain these crisis systems that we're looking to stand up. Thank you so much.
Thanks so much, Thomas. And I know there's some links in there, and I will send out the slides when the recording's available to everyone that participated in the webinar, in case you want those. So now I'm gonna stop sharing my screen, and I'm gonna turn it over to Jen Batterton, who is the Manager of Special Initiatives with the Allegheny County Department of Human Services. And she's gonna talk about Allegheny's focus on crisis right now and building on their existing crisis system, already impressive crisis system, to just further improve and enhance that, and how they've been going about that. So thanks so much, Jen.
Good morning, everyone. So Gretchen asked me to talk about our sort of process of convening a range of stakeholders in Allegheny County around improving our crisis system. And so I'm going to do that. So focus on process a little bit. I think, I don't know everyone on the call, but I think lots of what I'm going to say is sort of a narrative that we're all super familiar with now and focused on in our in our own jurisdictions. I thought I'd try to highlight a few of the sort of challenges that may or may not be unique to Allegheny County, and how we have attempted to address those, and with the hope that maybe some things that we've done or are doing or planning to do may be helpful to others. I think with the huge caveat that we certainly have not figured it all out, and lots of what I'm talking about is still very much a work in progress. And I recognize a couple names on the call from other counties that we're, actively learning from many of you. But I guess I'll just start with let's see if I can advance my slides. You all are you seeing a slide that says people are cycling? Yeah, okay. So I thought I'd just start with like, how do we decide to sort of embark on this stakeholder process of convening folks to identify ways to improve our system. I think the problem that we see in Allegheny County is likely really similar to what folks see across the country, certainly across counties in Pennsylvania, that, throughout the country, we're seeing that the jails have become places where folks with mental illness end up more than we want them to. We know that 1 in 4 people shot by police have a mental illness, and that half of people with mental illness get arrested at some time in their life. I don't think any of those data points are news to anyone on this call. I think I wanted to share sort of some of our local level data, just to give a sense of sort of how we used our data to pinpoint some of the disparities and some of like how acute some of our needs are. So what's on this slide now is sort of an illustration both that people are cycling through, not just through our jail, but through our crisis systems more broadly. And we've come to sort of refer to our homeless system, our mental health crisis system, our jail broadly defined as our crisis system, because really when folks are encountering any of those points, something has not gone right, and the sort of preventive safety net has failed them, and they're at a point of some kind of crisis, whether it's acute mental health crisis or that they're unhoused and on the street.
Jen, so sorry to interrupt, but I just want to let you know that I think it's in like presentation mode, so we can see your notes for the next slide. So so that's not a problem for us, but if it's, I just wanted to make sure you knew.
Thank you. Yeah, I didn't realize that. I thought that it was showing I thought it was giving me my speaker view.
Yeah, because it says slideshow, so I don't know.
Jen, if you go to display settings at the top, I think you should be able to switch so that you have the full screen of the presentation. It's at the top of the left, top left, in the middle, display settings. If you click on that, there should be some options that pop up.
I don't see display settings.
Oh, you're like hovering over it right now.
Oh, right here?
Yes.
Okay.
And then swap presenter.
Oh, look at that.
Perfect.
Okay. I wonder if that
you.
also might have been related to the fact that I'm on 2 screens here. That could be
I feel like
what
the
was
2
happening.
screens tends to mess things up.
Yep.
Thank you,
Okay.
Eunice.
Thank you for that lesson too. All right. Now you're just seeing a single slide. Is that correct?
Yes, it looks
Okay.
perfect now.
Great. Thank you.
you.
Yeah. So I think I wanted to share both that we were looking at our sort of disparities in how folks are accessing services, and seeing a real disparity in how folks are accessing preventive care. So seeing that Black individuals in our county are accessing things like outpatient substance use or mental health treatment, which are characterized sort of broadly as preventive care, the kind of care we want people to be accessing, less, and accessing crisis services, in some cases, disproportionately more than white people. So highlighting just that our systems aren't treating everyone equally, and that we're seeing these disproportionately high rates of individuals with who've accessed mental health services, substance use services, homeless services, and the emergency department hitting our jail. And so wanting to really figure out how to do better by folks in our county. And at the same time, I think understanding that in a place like Allegheny County, it's not always about like creating the new missing thing. We are a county that's relatively rich in resources and services, but we need those to sort of work harder toward a shared vision of keeping people out of jail, out of emergency departments whenever possible, and connected sort of more sustainably to care. And then I think another piece here is that, I don't know, perhaps particularly unique in Allegheny County is the sheer quantity of police departments that we have in the county. So when we're thinking about doing a better job at connecting police officers to alternatives and helping them better connect people to care in the community so that they don't have to bring people to jail in the emergency department as often. We were thinking about how to do that well for both for the city of Pittsburgh's police department, which is our largest police department, but also for, again, more than 100 other police departments in our county, some of which are just a few officers strong and sort of far afield geographically from many of our core resources. So just that is a particular challenge that we continue to need to figure out how to address in this work. But one of the ways that we began to go about identifying some new solutions is that we about a year ago brought together a crisis response stakeholder group, DHS, where I work, and we partnered with the organization Allegheny County Emergency Services, so another county agency, the organization that contains our 911 center. We came together and sort of co-convened a group of stakeholders charged with developing recommendations to prevent and respond to people experiencing crisis in our county. I think we invited 911 in early as a convener so that we could both signal and really focus on how to come up with some new strategies that start as early as a 911 call. And then I wanted to share also, and Gretchen didn't pay me any money to do this, but we sought help to add capacity and expertise as we convened this group, and we did after interviewing a handful of TA providers. We did engage the Justice Center as the facilitation team to sort of help us through this 6-month-long process of convening stakeholders to identify recommendations. And I can't really say enough like how important that was, not necessarily because of the Justice Center, but I do think that this was a really intense 6-month period with meetings happening, with lots of stakeholders involved, lots of communication needing to happen, and we were on a tight timeline. And just the additional capacity, and I think more importantly, the expertise, and even just having sort of a neutral convener felt really valuable in our local process. And the Justice Center was able to bring an equity lens and subject matter expertise in behavioral health systems, and really incredible facilitation skills. So I think that we certainly would not have done nearly as well without that team. There's lots of folks that offer similar TA, and I can't stress enough how valuable those additional resources were for our process. And then I guess just to flag a challenge in bringing this group together, we tried hard to put together a diverse group. We stumbled a lot, and we didn't satisfy ourselves or everyone else all the time, because again, with 130 police departments, we can't possibly have somebody from every police department at the table. And we were pulling this group together amid heightened tensions between law enforcement and community, and so it was tricky to pull together a group that met sort of all the different needs and brought every perspective to the table that we might have liked to have. So that, I think that's just always a work in progress, especially when government is convening. But we pulled together a group of stakeholders that involved law enforcement, community members, folks from academia, from the foundation world, from 911 and human services, and from our sort of core service providers, including our crisis service providers. We had about 30 participants across these sectors. We met for 6 months. The group was sort of charged with refining a vision and a set of goals and objectives. And the Justice Center took us through a sort of a mapping process to illustrate how our existing system works and the gaps and opportunities for improvement. And then ultimately the group generated a set of recommendations for improving the crisis system at each of 4 phases. So while we knew we wanted to focus on response, we also were looking at sort of early intervention and post-crisis recovery, and had sort of a subcommittee structure that could look at each of those phases. I thought I'd just share the vision that the group came up with, and this was sort of workshopped and over the course of a couple meetings, and but the vision really is what I've sort of been framing in my talk so far around creating a system where that builds trust with communities of color and meaningfully integrates community work and voices, where we have fewer people in active crisis because they're getting connected to the right kind of preventive care, and where whenever possible, law enforcement is not the first or only response on a behavioral health crisis call, where jail incarceration is no longer viewed as a primary method for connecting people to services and supports, and where people are aware of and have easier access to sort of culturally humble, trauma-informed human services in the community. So that was the vision that this group of stakeholders articulated together. And again, I think through this process with the Justice Center support, we went through a mapping of our existing system. I'll show you like the work product that we created as part of that process. And we also talked to lots of folks. So beyond the individuals who were participating in these regular meetings as part of the stakeholder group, we conducted focus groups with law enforcement countywide to try to get additional voices and perspectives from other police departments that might not be represented at the table. We had a focus group with frontline staff from the providers that are meeting people in crisis all the time. And then we had a focus group with individuals who have lived experience of our behavioral health systems and other crisis systems. And this is just sort of a snapshot highlighting some of the feedback that we got during these focus groups. And I think like we we saw a lot of similarities between the focus groups, and also some things that stuck out more in one versus another. But all of this feedback then was sort of fed back into the stakeholder groups process of articulating a set of recommendations and refining those. And ultimately, the group generated 16 recommendations. We have on our website, and I can include a link to it. I think at the end it'll be on my slides, with the sort of full recommendations written out. But I think in general, we really heard a lot about the need for more mobile response options. And when I say more, I think what we heard is both more in quantity, but also more in diversity of sort of the scope of service that mobile teams can deliver, more availability of resources that are available, the open 24/7. We heard a lot about, folks wanting a single number to call and get connected to the right kind of supports, again, any time of day. A big focus on increasing the use of peers throughout the crisis continuum, which is, something that our county has always been focused on, for many years have been focused on building up, but really heard a lot more about that. One of the recommendations that came out of this process was around, improving housing for folks in crisis and folks with criminal records. And, I think it just sort of goes to highlight how you really can't improve. Like it's hard to draw lines around your crisis system because basic needs are so integral in all of this work. So, and then I think another core recommendation, which is still very much a work in progress, is around sort of creating a coordination structure that will hold the whole crisis system accountable, and really draw on data and collect data in new ways so that we can be informing sort of quality improvement and troubleshooting what's happening to folks interacting with our services in a more robust way. So I just thought I'd show, partly because it's pretty, but this is a piece of the map that the Justice Center team helped our stakeholder group create. So it is, it is still sort of difficult to navigate a map like this. You see there's a ton of lines, but we were trying to articulate and illustrate what our current system looks like. And then the little red circles at different points correspond to the recommendations that the group made. So some of the recommendations relate to, mobile crisis teams, others to 24/7 walk-in, others to law enforcement and 911. And this has a sort of a corresponding document that shows keys to the recommendations. I thought I'd also just share a little bit about a part of our process that I think we're particularly proud of, and that probably went better than we could have hoped. As we neared the end of our 6-month process and we had a set of draft recommendations from the stakeholder group, we really still weren't satisfied that we had gotten enough input from a diverse range of community members. And so we decided to create a survey that we pushed out through presentations and shared with various networks over email and otherwise. The survey gave folks an opportunity to respond, sort of give their feedback on each of the draft recommendations, and flag issues around, suggestions or concerns around implementation of these recommendations. And we, in I think under 2 weeks, we received approximately 400 responses to this survey from across the sort of sectors of the community. And the feedback that we received has been exceedingly valuable, both just to have and understand that we none of this is ever going to be clear cut. People will continue to have concerns, but we were able to sort of create. This is just a snapshot for the recommendation to improve mobile crisis options, just a snapshot of some of the survey feedback that we got. Largely, the feedback was sort of in favor of moving forward with the recommendation, but with some concerns and ideas about how to do it well, flagging pitfalls and that kind of thing. And what we've been able to do with the survey results, and if you once I share the link to our website, if you're interested, you can like sort of navigate to, we've created a report for each recommendation that shows all of the public feedback. And as we are moving toward implementation of some of these strategies, we've been able to sort of share these reports and documents with additional stakeholders to sort of keep everybody on the same page about the kind of pitfalls and critical feedback that we're working to address. I think that's been a really valuable part of the process. And then I guess I just would, so I thought I'd share just a little bit about what we've been doing. So the stakeholder group wrapped up its 6-month phase in February. And since then, we've spent a lot of time, again, synthesizing the public feedback. Many of you may be well aware of the resource that was published, I think in the last couple months. A roadmap to an ideal crisis system has really become sort of a Bible on my desk and that of many others to help us with implementing some changes and still identifying additional gaps that we may have missed in this process. We've been focused on strengthening our partnerships between some of our core service providers and law enforcement, consistent with the recommendations that came out of the group, strengthening data collection and data sharing across our system. We've been really working hard on our coordination with 911, both to identify opportunities for alternative dispatch and to better understand the data that we have around calls that could possibly be routed to non-traditional responders. We've been also really trying to set the stage, build capacity and understand what's possible and how we can best leverage the new 988 number as a central crisis and diversion line. So trying to think about it as having the potential to do more for us than perhaps what the federal legislation contemplates. But because we really heard the strong desire for a single number to call, and every county has lots of numbers to call, but thinking about how we can leverage 988 and make sure we're ready for it, but in ways that might be broader than sort of what's initially contemplated for 988. Very focused on enhancing our mobile capacity and laying the groundwork also for, I think this is particularly exciting, and I'd love to hear if others are working on any models like this. We're laying the groundwork to create some peer respite models, which our county has not previously had. We've gotten some funding now from OMSAS to move forward with establishing sort of short-term peer run and operated residential respite spaces that we hope will be capable of serving as a diversion to from emergency departments as well. So I've sort of now combined the since February and what's next, but we're we're working on alternative response. We're working on peer respites, and have been able to get some funding and really identify some paths forward for both of those things. Another piece that came up in our work with the stakeholder group that has sort of in our conversations with stakeholders since February really become a core issue for us to work on that wasn't flagged as a specific recommendation is identifying better transportation solutions for our crisis system. So we're hearing a lot of frustration both from service providers and police about the need to rely on police for the involuntary commitment process, and from all angles, it seems we're trying to explore what's sort of legally, regulatorily, and sort of based on everyone's risk tolerance possible, so that we could be relying on law enforcement less when there is a need to do an involuntary commitment. We're also piloting law enforcement assisted diversion with groups of municipal cohorts. That's work that we're teeing up to sort of kick off in the next couple months, and building toward sort of bringing back together a version of the crisis stakeholder group to serve as sort of a coordination structure for our crisis system. So I wanted to sort of end with this slide, which is I sort of think of it still as like a draft vision statement for where we think we want to be heading, but with the overarching idea being that, you know, like many of us, hoping that we're building toward a system where for somebody in crisis, it is less likely that they'll need to call 911, more likely that they'll know that they can call this other number, but that no matter where they call, no matter which number, we have the right kind of responder that's going to be dispatched. So again, tying that back to diversifying the kind of mobile teams that can be dispatched from our call center and from our crisis call center, and also diversifying the kind of mobile teams that can be dispatched from 911. And then thinking about the kind of supports that we want to build in and spread out throughout our county, which are now sort of focused and concentrated more in the city of Pittsburgh, but thinking about how we can get those out in sort of regional hubs throughout our county, so that folks, no matter where they are within the region, have sort of better access to the kind of crisis supports they need. And this is like, again, I think Thomas sort of spoke to all of these sort of intended outcomes in his presentation as well, but this is really what we're shooting for. I'll stop there. The link to additional resources on our website is here on the slide. So when Gretchen shares them, those will be available to anyone who's interested in taking a look. And I will stop sharing. And I have no idea how long I took, but nobody cut me off. So
no, that was great. Thank you so much, Jen. It was really great to hear about the planning process that Allegheny went through and next steps for you all. It sounds really exciting. So I appreciate that. And I'm just going to put up a slide for Darcy, but we're going to turn to Darcy Alt, who's CEO, Heart of Iowa Community Services of Dallas County, Iowa, which is one of our Stepping Up Innovator counties, to talk about some of Dallas County, Iowa's efforts around crisis. So thanks so much, Darcy.
Yeah, so I don't do slides very well, and the person that usually helps me with my slides was out last week, so I apologize. You're just going to get this really cute picture. I think that a lot of what Jen talked about was really awesome, because we've been doing crisis services since 2009, and we've been through a lot of those growing pains, and we're still going through a lot of those growing pains. So Heart of Iowa Community Services is actually 3 counties, but Dallas is our first innovator county. And we didn't regionalize until 2014. So crisis services began in Dallas County, which was our first county. in 2009. We started with mobile crisis and then expanded to crisis stabilization. We also had jail diversion in there, and we were also heavily involved in our courts. And we consider all of that part of our crisis services for a lot of reasons, just for the simple fact that all of those crisis services involve diversion in some way, shape, or form. And all of it involves, or a good majority of it involves law enforcement, because if we're dealing with hospitalizations or anything like that, we could possibly have a law enforcement component. And we feel like through everything that we're doing, we're educating. We're talking with law enforcement about what we're doing. And it's not only telling them what we're doing, but we're working with them through the process. So I think probably about 5 years ago, we began training law enforcement in CIT in the state. And in my Dallas County, my staff actually go to our state law enforcement academy, and we do the 40-hour CIT law enforcement training for them 3 times a year. We put probably about 300 law enforcement officers through that training each year and certify them, which has been a huge boost for us, just for the simple fact that I think as far as crisis training and mental health training for law enforcement, that's huge. If we can teach them and train them, and they're the first responders, that's exactly how we treat them, just as the first responders. And it goes a long way in just defining their role to make sure that they know that we don't expect them to solve the issue. We don't expect them to be the counselor, the therapist, the psychiatrist on the scene. And I think that the current culture, the current dynamics in the country really have put them on the spot. And that's where we start with them. And it all starts with that conversation with them to help them understand that we simply expect them to be mental health first aid. And it's our role to put those resources in place for them. And that goes a long way to put them at ease. So I'm really excited. I was really excited to get to talk to you guys today, because when we are talking about mobile crisis and we are talking about the crisis services, it does put them in kind of a weird spot. And I really liked the listening session slide that Jen had, because that outlined a lot of the issues that we come into with law enforcement. Because when you're developing mobile crisis and you're developing those crisis services, what we have found, even though we've been doing mobile crisis for a long time, is one little thing that you do wrong, or mobile crisis doesn't show up, or they put off that call, you can ruin relationships with law enforcement. And so the conversations I have with my mobile crisis is, if law enforcement calls you and they ask you for a Band-Aid, when you're starting out, you take them that Band-Aid, because those irrelevant calls in the beginning become more relevant once they really understand what you're trying to do. And so I was really interested in Jen's discussion, because I think that leads to a lot of the issues that we find with law enforcement, because they are really scared of those interactions a lot of the time, and they're scared that they're going to do something wrong these days. And so they're not taking it out on you. They're just really worried they're going to do something wrong on that call. So they want you guys, or they want mobile crisis to get there as quickly as possible. And they want those resources. So in Dallas County, we have mobile crisis, and it's actually dispatched 24/7, and it comes out of our crisis stabilization unit. Mobile crisis is able to de-escalate at the scene. And what's really helpful when those officers are CIT trained, they understand that it may take mobile crisis a half hour to 45 minutes to get there, but if they have it de-escalated at the scene, then mobile crisis simply takes that person off their hands and they're good to go. And if we have to market it that way, then it's okay, because what we're really trying to do is get them back to work and help that individual out that is in crisis. And it's a win-win for everybody. I think one of the things that my fellow CEOs and really CEO is just a weird title because we had to regionalize. And so they gave us these weird titles of CEOs. We're just mental health directors, but we get kind of tied up in, we've got to help the individual, but we've got to help law enforcement too. And at the end of the day, if we get that individual help, that's all that matters. So one of the things we get tied up on is arguing with law enforcement about who's right and who's wrong on that call. And really, it just matters if the individual gets help. So we want to get that law enforcement back out there. In Dallas County and in most of Iowa, mobile crisis can transport to the hospital, or they can stay on scene and provide resources, or they can transport to crisis stabilization. Mobile crisis in our area also goes into the jail. So if somebody is being dismissed, ROR'd, they've bonded out and they need mental health services, our mobile crisis will show up and assess the person there. And if they need to go to the hospital or for crisis stabilization, they can transport that individual and help at the hospital or admit them to crisis stabilization. So funding is really kind of wonky in Iowa. And what we do is Medicaid will fund crisis stabilization, or if the individual does not have any type of insurance, Medicaid mostly, occasionally we can get another private insurance funder to fund, but that's very, very rare. In Iowa, we actually have property taxes will actually fund the county's mental health system. And so that funding would actually come from me. Our crisis stabilization unit was actually built by Dallas County and our region. And we pick up for anybody who is not funded by Medicaid. So it's kind of a cool process. The individuals that come into the crisis stabilization unit can stay for 3 to 5 days. Typically, if they have Medicaid, that will pick it up. Now, the issue we run into, we are an MCO state, and a lot of times the MCOs will not pick up after 5 days. So if the person does have Medicaid and the MCO will not agree to pick up after the 5 days, and the person does need an extra time, then we'll pick it up. We recognize that sometimes folks are not able to go home right away. They need that extra support. And we do have an extended stay option. Also, as a part of our crisis stabilization unit, we have a 7-studio apartment transitional living unit. And if they need to go over there because they just need maybe 3 to 6 months to get back on their feet. Maybe they needed to go to inpatient substance abuse treatment from crisis. And once they get out of inpatient treatment, they decided they need transitional to complete treatment, to complete skill building. Then we actually fully fund the transition. Now, transition is a part of the diversion. So if they've been in jail or they need a transition after crisis, we work closely with the courts. If they're an individual that came to us out of jail, we'll work on getting them ROR'd from jail and work with their attorneys. I have 2 jail alternatives folks that go to court every week. They also spend the majority of their day in jail working with folks that are in jail. We have a 124 unit jail. It's probably not called a unit, but cell jail. And I apologize. We just went from 34 cells to 134. It was massive, and that opened in December. So that created an issue where I needed to hire an additional staff, and they're in there practically all day long now. It was quite a change, but we get folks out of jail and we can do that. Sometimes it's the next day after they've come in. Sometimes if we have somebody really in crisis, when they come in at night, if if the deputy hasn't called me to talk to me about the individual and diverted right then. If the charge they felt was too much and they had to book them into jail, then they can contact me and I'll call the magistrate and we'll try to divert them right then to crisis, as long as they're not assaultive. We also try to get their meds right away brought into jail, and then we'll get them released in the morning and taken up to crisis. So that's another way that we divert them. And then we can work with the courts and the probation officers to get them up to our transitional housing unit. So the way that the transitional housing unit works is we'll work with probation, we'll work with the courts, we can get them into inpatient substance, and that's usually off-site. If they are ordered to outpatient, we can actually do part of it at the transitional unit. We also do mental health therapy at the transitional unit. We have a therapist directly on site. We also, after like a month or two, once they've worked solely on their substance and mental health, we get them into employment. After a month or two of employment, we then begin looking for housing, and that's the last phase. So once they've secured housing, they know where they're going to work. And a big part of knowing where they're going to work and where they're going to live is not putting them back in the home community where they used and where their negative influences are. So even if they're not going to live in Dallas, we will still pay like first month's rent and deposit. If they need a little bit more than that while they're trying to save up money from their job, then we'll pay a little bit more than that. And then we refer to services similar to ours in the county that they go to live in. All the while that they're getting all of these services, they work with a service coordinator from my office. If they come from the jail, then they continue to work with the jail diversion coordinator. Or if they came from the community, then they work with a service coordinator out of my office. The same with crisis. Whenever they're brought in from crisis, no matter where they came from, as long as it wasn't from the jail, if they came from the community, they'll work with a service coordinator. If they came from the jail, then they continue to work with the jail diversion coordinator. So we do all of those things. I don't want to run over too much on time. So data collection. We have a statewide system that we built, and I was really fortunate. We've had our jail diversion program since 2009. And we had purchased a program, I think, out of Florida or something like that, that had all the components that I had wanted as far as data collection. So the statewide system that all of the regions use, we were able to work with them and build a program similar to what I was using. So the data that we collect is actually, and I have my notes, so excuse me, I'm going to look down. I apologize for that. But we actually go by the Stepping Up initiative. We are utilizing set, measure, and achieve. And the goal that we're looking at is reducing recidivism in all the services and the data that we collect. So we actually are tracking the charges that individuals have when they come in. So every time somebody comes into the jail, we have them, they're screened with a brief jail mental health screen. And that's recorded directly into our system. And then we utilize bookings and the dates. We're able to track the days that they come in. So we could keep track of their dates and then the dates that they leave. We keep track of all of that. And then we can pull data on each individual to know when was the last time they came in, if they've stayed out, or the time between bookings in. We can also put all of their appointments in and their connections to care. While they're in jail, actually, we start their mental health services. We have therapists in the jail. We have psychiatry in the jail. We have substance abuse in the jail. All of that is funded through my office. So that gets them started to hopefully reduce recidivism while they're in jail. And then as far as data that we collect, we keep data on all the mobile crisis calls. Annie, yes, we use a CSN system. I'll have, it's a county services network. I will have, my gal should be back this week, and I will send that to Gretchen and have her send you the slides of what we have. I do apologize for not having it this week, but I do stink at technology. I'm much better talker. I could talk all day, but I won't. We're going to run over in time. I will send you all of my information, and you guys certainly can have my email and everything. And I would love to share that with you because it is really cool. And we do, right now, we're building the system to collect our crisis data. Right, we can put data in there, like we mark them as events. So we can put commitment information in there. We can put mobile crisis events in there, things like that. But it's mainly, we're really honing down the jail diversion information, because what the state of Iowa has done right now is they've done legislation, and when we regionalized in 2014, and they called certain services core services. Right now, jail diversion services are not core services. So we're doing a lot of things to justify jail diversion services. Our governor loves jail services, but has not made them core. All of the crisis services are core. And I can send out to you what we're collecting on crisis too. It's just in a spreadsheet until we have it built in our system, but I'll get that for you as well, so you can see what we're doing. So right now we're using a lot of our data to show how much we're spending, what we're actually doing, and we're really bulking up our jail diversion services. But I'll get the jail stuff to you, and I'll get you our mobile crisis so you can see, and our crisis stabilization so you can see what we're collecting. I'll stop talking.
Thank you so much, Darcy. Okay, so we're gonna do Q&A for all the presenters. So I know Darcy kind of addressed one of your questions. Annie also asked how the crisis stabilization unit was funded. I know you said for people that have Medicaid, and sometimes you can cover private, but how was it initially funded, I think is maybe what she's wondering.
So initially, it was when we regionalized and we pulled dollars to fund it. So ours was a little bit wonky because we had to find space, and the majority of ours was, I had to remodel this building that was in god awful shape. So the majority of the initial funding was actually on the remodel. It cost me about $650,000 to remodel the building. The hardest part for us when we were putting it all together was it took so long to get the it's not the accreditation piece, it's the licensing or the applications with the MCOs were a huge holdup. And in the state of Iowa, when we did it, we opened it in August 2015, and then in April 2016, Medicaid privatized to the MCOs. And what happened was my provider applied with the MCOs, and they said, sure, great, we'll contract with you. And then they didn't have codes for another 2.5 years for my provider to actually bill. So I fully funded it for 2.5 years, which was fine. I had the budget at the time to do that, but it drained us pretty quickly. So they didn't actually start paying until October 2018. It was a little crazy, but we were also, go ahead.
Can you tell us what is the budget and how many people the crisis stabilization unit serves?
So I went a little probably above, but I had a 2-wing nursing home, and I was like, yeah, let's do this. We were the first in the state. And so I have 8 crisis beds and then 7 studio apartments. So I'm bigger than a lot of the other crisis stabilization units in the state, but my total regional population is only 115,000 right now. I have Dallas, which is the 4th fastest growing county in the nation. So I'm going to double in population in the next probably 15 years. So I'll be 200,000 in the next 15 years. So we're good. But I contract with so any county in the state can use my crisis stabilization. So the neighbor next
That's
door to me
nice.
is like 15 counties, and he is half my beds half the time. So my budget started out, I probably spent 1.1 million a year on that thing. And now the only issue I run into is I've had to change providers once. And I think that there are other ways to fund it. There are grant opportunities. There was a SAMHSA grant that was beautiful. Should have been like 2 million over 2 years, and my provider didn't apply for it because it was for community behavioral health centers. And there was an excuse as to why. So I'm probably down to 500,000 a year, honestly, because Medicaid is paying for everybody who is Medicaid eligible. And they're probably 2/3 of my people using it. Now, the thing is that the crisis, half of that is transition, and there's no payment mechanism for transition, but that transition side is amazing. I wouldn't give that up. It's fantastic for folks going from crisis to transition who need to get back on their feet. And for my jail alternatives folks, it's a godsend, and it's full all the time. But if crisis side is full, and usually we're at about 65-70% capacity. If crisis is full, it'll pay for the whole building. So it's less when crisis is full. And as far as waiting lists, no. There's usually not a waiting list. What we've for transitional, yes, there's usually a waiting list. For crisis, there's not. And if we have somebody that's waiting to go into transition, we will do extended care and start their transition on the crisis side. But we don't have any type of homeless shelters in Dallas. I think that that's kind of one, we're so close to Polk, which is a county of almost 500,000, and they have homeless shelters. So folks over there, transitional capacity is 7 studio apartments. It has been a godsend. We have had law enforcement call me. One of the worst cases we've had was an individual who they got a welfare check called to a hotel, and this individual who had intellectual disabilities and some mental health issues, he was in his 30s. He was about the size of a 13-year-old, malnourished. He didn't realize that his mom, who was in her 60s, she had passed away a couple of days before. And they weren't sure what they should do. They wanted to make the referral, and they thought they were going to take him to a homeless shelter. And we said, oh, good Lord, no. We've had him there for probably 2 to 3 months. He's been at our crisis center, but because we have to start from scratch. They had been transient, and they'd been going from state to state. They'd been here for several weeks. Luckily, the hotel was in our county, and we have to get updated psych evals. We have to do IQ testing, all of that to get them on the right waiver and get them into the right type of housing. But I feel very lucky that we're able to keep them there because we'll keep them safe. Nothing will happen to them.
Thanks, Darcy. And we have a question for Jen. It looked like there were a lot of different stakeholders involved in your planning process. Were there any stakeholders, without naming which ones, who didn't really want to take part, or who were a little hesitant maybe, and just how Allegheny handled that?
Yes, there were. I think I sort of alluded to this, but we invited some folks to participate who were not comfortable coming to the table with law enforcement. And then we also, and who I think, rightly so, but really wanted to have a community-led process that could make a set of recommendations to the government and also push local government from the outside. And that process did occur in our county more or less in parallel to the crisis stakeholder group convening. It wasn't sort of exactly the same timeline, but we made efforts to sync up with a group of advocates who was sort of spearheading this parallel planning process. And it came with its own set of challenges, but I think was the sort of amidst the challenges, the sort of best solution for our collective process, so that we could get the voice of folks who were more comfortable pushing us from the outside.
Thanks, Jen. And then another question for you. My understanding is that Allegheny has a lot of people. There are areas within the county that have a smaller population. So how did that lend to your planning? Was it more difficult to account for different geographies?
Yeah. So, I mean, I think this is something that we still have not really cracked this nut, but we did. So one of the stakeholders that we had at our stakeholder table was from an organization called Connect, which stands for the Congress of Neighboring Communities. So Connect is a convener of municipalities within the county, and they certainly don't only focus on community health or public safety. They sort of troubleshoot around, like, how can we share resources for like recycling programs and a variety of things. But they are an organization that has sort of established connections and convenings for municipalities, including the city of Pittsburgh, but with a focus on making sure that they're getting sort of connected with and hearing from all the smaller municipalities in our region. And so we had them at the table. They are also taking a lead on organizing our law enforcement assisted diversion work as a convener and project manager, with the county supporting with some human resources and also funding. So that's been one way. Another way is that we had a representative from the chiefs of the County Chiefs of Police Association, which again, it's just like none of this is perfect. And I think as a county government entity, it's difficult for us to do everything in like a pilot that would best meet the needs of any given organization, because we want to be doing big system change kind of things. But it's just a balance, I think, that we're still trying to figure out and strike with partners. And we certainly fail also.
Thank you, Jen. And one more I have for you while we're speaking. Let me just find it. How important was it to have advocacy groups and the community involved, and people with lived experiences, communities most impacted by these services and systems involved in the planning process?
I think it was hugely important, and I think we knew all along that there was more that we would like to have even more. So I think I share this openly because you could Google your way to a news article about it. But we did face criticism in terms of how this stakeholder group was composed. And so, and we knew that we tried hard to have the right kinds of perspectives at the table. We also faced some constraints for various reasons that I've already shared. So like some folks who we would have wanted at the table didn't want to be at the table, and that kind of thing. But that said, I think we tried really hard to create like other kinds of conversations that could feed into this work. And the survey helped us get even more feedback from people who have experienced our system in different ways. But yeah, I mean, I think that the voices from folks both at the front line of service provision and folks with lived experience, I think they've informed some of the strategies that we have moving forward in really important ways. I don't know that we would have gotten to the peer respite piece without this, like the strong voice of people with lived experience. And we need them to stay involved in implementation too, because it won't be a peer-led respite without folks with lived experience taking the lead. So that's, I think that's a really exciting piece that we're taking on, that hopefully will also create an organization or a set of resources that can continue to inform the broader crisis improvement work. So yeah, can't be understated.
Thanks, Jen. Okay, and for Darcy, I think you did answer Cynthia's question that's in the chat mostly. I just wanted to make sure. I know you answered about waiting list. She's asking how long for extended care and transitional living units. I think you may have answered that. And she said, if there are, is there a bottleneck on the other end, or do folks stay in community awaiting placement?
It depends. So a lot of times, if they're on crisis, we'll actually start them in extended crisis and get things going. So if we have an extra bed over there, or if we end up with them waiting too long on extended crisis, we'll go ahead and start things in the community for them, depending on what their needs are, and do intensive services with them in community. So we oftentimes, because my service coordinators tend to act as an assertive community treatment team, they do a lot of direct services, making sure people get to appointments, making sure that they have food. One of the things that we actually have within my office is a food pantry. With CARES Act dollars, we started that up, so we're able to make sure folks have food and all of those things. So if we have to start them in the community, we will. And that's usually if they've kind of been hanging out at the crisis center for a month or more. We'll just get everything started up in the community for them, get them housing, start the work services, because they've already started their substance and their mental health therapy at the crisis center. They've been doing all of that, and then we'll start intensive services in the community. Typically, the transition center is 3 to 6 months, but we usually use that weird term max benefits. So if they've gotten everything that they needed and they're ready to go sooner, that kind of dictates when they move out. So they could be going sooner, but because people are coming and going all the time, that waiting list is a moving target. And let's be honest, people do fail out of there. So slots can can open up sooner rather than later. It's a little bit rare, but we do have their rooms are checked regularly. So nobody can bring paraphernalia in, nobody can bring drugs in. But if you have somebody that is court ordered there and they're just hanging out because they're avoiding prison, then that's your person that wasn't dedicated and didn't really care in the beginning. And they're the ones that are probably going to go. So when they are being interviewed for that spot on transition and the attorney really wants them there and they don't care, then they're the ones that are going to max themselves out a lot quicker. And so we have, it's a peer run transition as well. I didn't mention that. And he does a really good job of making sure that somebody doesn't come into transition that would affect the rest of the group as well. So that's a big factor because it is a community in that area, and they don't want somebody that's going to be disruptive.
Thanks, Darcy. And then I think this is for both you and Jen from Commissioner Heimel. Is there any sustainable funding, or are these initiatives more along the lines of year to year and or grant dependent? I think just for any of the crisis services that you spoke about.
So for mine, it is, since it is a core service, the funding has to be there. And in the state of Iowa, we're actually moving away from property taxes. And over the next couple of years, it's a state funded service. So my office will now be funded through state dollars. There is some Medicaid funding for mobile crisis and crisis services. The next thing we'll be working on is trying to establish some sort of funding for the transitional services.
Yeah, and on our end, well, I think we are certainly being opportunistic about the wealth of resources that's now coming down from federal, and how we can use ARP money to jumpstart a lot of this work. But we're also really focused on figuring out how to make Medicaid work even harder for our crisis system than it does now. So that's sort of on the policy side of things, having those conversations. And yeah, I think that would be, I think we know that the money that we have right now has to be replaced by something more sustainable.
Great. Thanks so much, both of you. I think, does anyone have any other questions for Jen or Darcy or Thomas on the housing front? Because I think that was all I saw in the chat. And feel free to just say out loud if you want to ask your question.
I would just add one other thing on the sustainable funding that I didn't mention is, and this is still very much just a work in progress, but I think we also know that we want to start looking at how to have private payers be paying into our crisis system. And the county currently covers folks who are not Medicaid eligible when they hit our crisis system. And there's no reimbursement process in place for the private insurance payers. So that's another just like big picture item that we have on our radar to work towards.
Great, thanks, Jen. Okay, any other questions? So, oh, thanks. And Thomas just put out a publication that the Justice Center did. I think he might have talked about it a little bit in one of the slides earlier, but about using American Rescue Plan money to build out crisis systems further. The Justice Center has a guide on that. So we were planning to do some breakout group discussions, which would probably just be 2 groups, but we're a little bit behind schedule. And so usually those are helpful with a little bit more time. And we know that 2 hours is a long time to sit. So how do people feel about, these were kind of the questions we were going to go over. We could still do short sessions, or we could just end early. Does anyone want to give me like a thumbs up or write in the chat if they want to do the breakout discussions? Or you can just say.
If we didn't do them, I would go hop on another call. But I also love talking to folks about what they're working on, so.
Okay, thanks, Jen. And we could also, if anyone has anything to say, any comments they want to make, anything they want to share about their county, just in this large group before we head out, that would be great as well. Otherwise, okay.
No, if anybody has any information about, in Pennsylvania specifically, we had heard from OMSA's policy that they had applied for a federal crisis grant, and we were advised that they would be meeting with us in the near future. I don't know if anyone on the call has heard anything further about that.
Not
Okay.
about like a timeline for meetings.
Yeah.
Yeah.
We're anxious to hear.
There's one more question. Do the crisis folks work with co-responders, or how has that worked with jurisdictions that chose co-responder as a branch of that mobile support?
Good question.
So for us, I think it depends a little bit on how one defines co-response. We, in our county, we do not currently have like a ride-along model. So we don't have social workers in the cars with police, but we do have teams, mobile crisis and otherwise, who can be called by police to the scene. And we are hoping that in the work that we want to roll out with some of the new funding, that some of the alternative dispatch from 911 can be, or some of it we hope will be simply an alternative responder and not with a police officer. But we know that there will be some calls where it will be a dual dispatch, and that may look like two different cars arriving at the same time or approximately the same time. So closer to a traditional co-responder model.
So in our area, we do a few different things. When it comes to schools, our mobile crisis has agreements with schools that the schools just call mobile crisis directly, no law enforcement involvement. When it comes to community, typically law enforcement is the one that initiates mobile crisis. We've had incidents where it was unsafe for a mobile crisis, and keep in mind, this is a model that we've had in place since 2009. And I think the model is evolving so that mobile crisis will get more comfortable with responding on their own. The problem being that every time we get to that point of mobile crisis feeling comfortable responding on their own, we have an incident. And so you kind of get that comfort level of, okay, we're going, and then there's a weapon. And we're just trying to find that happy medium because we've had incidents, and we've just been doing this a long time. But the other thing too is a lot of times the general community doesn't call for mobile crisis. And I think once 988 is rolled out and there's not 10,000 numbers, and the community knows that, okay, my loved one is exhibiting these signs and this looks like mental health, I got that one number to call, I'm going to call it, and I know that's mental health. I think that's when it gets better, because a lot of times in our area, our officers are like, well, he's committed a criminal act, but I don't want to take him to jail. I want mobile crisis to take him off my hands because I don't want to do the work. So they'll call mobile crisis. So I think in our area, that's the difference, is our mobile crisis calls are initiated by law enforcement the most, because the general public is not making the call. So I think that's when maybe our distinction comes around, when we can actually maybe go out on mobile crisis without law enforcement. I think that's the difference.
Thank you so much, both. Okay, I think those were all the questions. Okay, and I just wanted to notify, I probably notified everybody about this already, but I think this virtual event is going to be really good, something the Justice Center is putting on in partnership with the Bureau of Justice Assistance and the University of Cincinnati to explore innovative community responder models and just how jurisdictions are building comprehensive crisis systems to ensure that crises of all sorts receive the appropriate response. So that's going to be October 20th and the 21st all day. You can register on the Justice Center website or the link below. And then just in terms of the TA Center, just be on the lookout for upcoming events. We're planning for some additional webinars and TA opportunities for the future. So we'll be in touch with more information on those soon. As always, would love to hear your feedback. If you have ideas for topics that you think would be helpful to hear about through webinar or to discuss over the phone with counties or whatever it may be, please let me know, email me, write me in the chat. We know that there was a lot covered today and that every county is really in different places with this work, but just hope that this training helped you wherever you are, and thinking about next steps for your county or county around crisis, and working on your stepping up goals. We'll share the recording of the training. I know Darcy's going to send me some stuff that she says I can share, so appreciate that. Just want to thank the presenters one more time. Thank you so much. Thanks to PCCD and Magic for the support with the TA Center. And thank you to all of you for attending. So I just hope everyone has a great day. Thank you so much.